The most common developmental disability is those with intellectual disabilities, with roughly 6.5 million people in the United States having an intellectual disability. People with intellectual disabilities are a vulnerable group due to their cognitive limitations and are more likely to have low health literacy, especially if there is a language barrier, which oftentimes there is. Unfortunately, as stated in the textbook, people with disabilities are rarely mentioned in the context of health literacy in particular and health inequalities in general. Individuals with intellectual disabilities often rely on caregivers to explain to the provider what is going on, but may not be adequately explaining the problem at large. Here we have two forms of miscommunication going on, from the patient to the caregiver and then from the caregiver to the provider. This is especially important for people with intellectual disabilities who may not have the ability to speak at all. Just because someone is unable to speak does not mean that they don't understand what is being said to them. Patients with intellectual disabilities may also have a team of providers, such as physical therapists, residential nurses, and direct support staff, and it's important that they are all effectively communicating with each other. And I do want to emphasize that just because they have a group of people supporting them and speaking for them and communicating on their behalf, the individual with the disability should also have a voice in this conversation. Communication barriers can lead to patient safety issues, readmissions, poor health outcomes, and medical errors. Providers often focus on the caregiver and not on the patient, and this doesn't help with creating that level of trust. If the provider is unable to communicate with their patient, or if the patient only speaks sign language and the provider doesn't understand what the patient is saying, then, we have a problem. Providers may also experience bias towards someone with intellectual disability, thinking that they may not understand what is being said. Progress can be made in this situation by the providers creating a lasting and trusting relationship with the patient and their caregiver, which we don't often see a lot of times. And this is coming from somebody who has worked in this field, direct support care and taking people to appointments. Oftentimes providers can be very impatient and they don't really take the time to sit there and try to communicate with, the patient at all with the disabilities, and they just kind of go in and hand you paperwork and just try to get you out because they don't really want to deal with it, which also just isn't really cool at all. The Joint Commission reported that communication problems are the most frequent root cause of serious adverse events. Low health literacy among individuals with intellectual disabilities can lead to misunderstandings about medical conditions, treatment plans, and medication instructions. This may result in inadequate self-care, missed medical appointments, and increased health risks, emphasizing the importance of accessible health information and communication strategies for this population. Health literacy is an important component specifically for individuals with intellectual disabilities, as it empowers them to understand health information, and also because you want to encourage them to be as independent and live a normal life as possible. So I think it's just really important to at least loop them in on these conversations. And it also allows them to make informed decisions about their well-being and effectively communicate with healthcare providers, ensuring that they receive appropriate care tailored to their specific needs. It's important to stress the continuation for developing effective health literacy interventions. The interventions that do exist are relatively new and not always effective out of the ones that are put in place, which is not many. There are interpreter phones available for people who speak different languages, but that doesn't help with a patient who uses sign language to communicate. Even when you go to a doctor appointment, and they give you, pamphlets or paperwork to take home with the medical instructions on them, I think it would be extremely effective if there was an option that laid the instructions out in sign language, just printed right on the paper. Having professional interpreters available for sign language specifically and diverse languages can just help facilitate understanding. I believe that there should be an incentive for providers who want to expand their learning, whether that is having, just like the organization that you're working for offer sign language classes, or, pay to have you take them at a local school or a university. And then those that do take the classes would get a pay raise, essentially. Kind of like they offer people that are bilingual, you make more money usually, and that's a sought after skill. I feel like the same should be said about sign language too, encourage learning in that aspect. Although I had previously mentioned that sending home pamphlets and instructions in sign language, an alternative could also be providing access to websites or videos that go into further detail on an individual's specific needs, whether this is kind of just care videos for taking care of like a G-tube or a colostomy bag. A lot of times the individual themselves won't be doing this kind of care, but as they're watching, you know, their provider or their caregiver do it, they can kind of just see what's going on and just kind of feel comfortable knowing that what they're doing is right, or maybe just kind of guiding them in something that they may be doing wrong, whether it's not like sterilizing the area. This is extremely helpful in a situation where the doctor might feel rushed or doesn't have enough time to thoroughly explain take-home instructions or what the overall diagnosis actually is. The responsibility to present information in a way that patients can also use and understand falls not only on the healthcare professionals and providers, but on the organization as well, and just making sure that everything's running effectively. And this goes a lot into health equity, which I'll touch on in a second. And there are healthcare facilities that are specific to people with intellectual disabilities, and just people with disabilities in general. But in order to encourage someone to live a normal life as possible and to be independent, many of them want to go to main facilities such as, you know, Albany Med or St. Peter's, and they don't always want to go to Center Healthcare. And then not only is health literacy important for people with intellectual disabilities, health equity is as well. Health equity for people with intellectual disabilities is vital to ensure fair and just access to healthcare resources, services, and opportunities. It addresses disparities, promotes inclusive care, and recognizes diverse needs. And it also fosters a healthier and more equitable society for everyone, regardless of their cognitive abilities. And I feel like earlier when I was talking about people with intellectual disabilities, I kind of was more, I don't know, I feel like I touched on people that really can understand things more and maybe just don't have a way to verbalize it too. But then you have people with, you know, more severe intellectual disabilities that completely, like, their care is in the hands of their providers and their caregivers, and just being in that position, I don't know what I'm saying.